Morning, everyone. I'd like to call the meeting to order. The first order of business is the review and approval of the minutes from the April 21st, 2023 Board of Health meeting. Do I have a motion to approve?
So moved.
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. The meeting minutes are approved. The next item on the agenda is to review and discuss coronavirus COVID-19 update. So any reports from Worcester?
Yes, good morning, Mr. Chairman.
Good
Happy
morning.
Friday to everyone. I will ask my colleague, Ms. Amelia, to give an update. Amelia?
Hi, so we've stopped reporting to the schools. The cases are very minimal. And we've ended our mobile clinics. We are participating in the Whole Kids event in Worcester this weekend. Rain date is Sunday, where we are bringing COVID vaccine bivalent. The monovalent vaccine is no longer available. And we're also bringing flu vaccine for kids. In terms of COVID cases, there's very little to track at this point. And we've really only had, in terms of other communicable diseases, maybe one type of cluster event in the last month in a long-term care facility. That's it for the COVID and the vaccines. Also, vaccines.gov is the place to go if you want to find where you can get a vaccine.
Okay. Dr. Abraham, do you have anything to add to this?
No, other than there is still some community prevalence. The statewide prevalence, which was listed yesterday, published in the Globe, was 2.95%. We're still seeing several hundred cases, but no overwhelming clusters or numbers. As we've talked about, the wastewater surveillance data continues to remain relatively low. People are still getting sick, unfortunately, but very mild disease, low hospitalizations, very low numbers of deaths. I think the challenge has been to try to educate people who have not had the only COVID vaccine, which is now available, which is the bivalent, the booster. All the original vaccines have been withdrawn as they are no longer effective against the current variant. So convincing them at least to get that and then wait till the fall when we hope there will be another vaccine with some reformulation to cover the new variants currently in existence.
Okay, thank you, Dr. Abraham. Are there any other further comments or questions from the board? Okay, well, thank you, Amelia and Solo. Okay, the next item on the agenda is to review and discuss updates from the Central Mass Regional Public Health Alliance. And Micah, do you have anything to report?
Sure. I've done about 45 inspections since last month. It's kind of been a wide distribution between nuisance complaints, food, pools, camps, kind of everything is happening from April through June. So just trying to stay on top of all of that and make sure all the swimming pools can open on time. So we are working on that. We had 2 foodborne illness related complaints, but neither one of them were founded. And that's really all I have at the moment, unless anyone has any questions for me.
Okay, so we're getting complaints of dust from the 420 Boston Turnpike?
Yes, so I believe they had not implemented dust control until the complaint came in.
Oh,
And as soon as that happened, they did go out and get like a water trailer, and I've been keeping a close eye on it because I drive by there multiple times a day. So now that we know it was an issue, it's being monitored, and they are wetting it down pretty much every time I drive by. It looks like they're working on it.
so is Mass DEP involved in this at all, or is just keeping it local?
Mass DEP refers most of this to local boards of health and use themselves as the last ditch option.
Okay. Okay, are there any yet further comments or questions from the board on the report?
Nope, not at
No.
this time.
Okay, if not, then I guess we'll move on to the next meeting schedule,
June 16th or 30th, if
June
that is an option.
16th. I could do the 16th.
Let me check. I cannot.
Okay,
June 30th.
30th?
Yes.
Okay. So let's make the next meeting for June 30th at 8 a.m. in this room. Okay, if there are no other comments or questions, do I have a motion to adjourn?
So moved?
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone.
Thank you.
Thank you.
That was a record.